Thank you so much. I'm looking forward to sharing with you today the development of our advocate program and what we've learned and the importance of having those advocates in the organization to support physician well-being. So what we're going to cover during our time together, we're going to look at a backdrop for burnout, culture, and well-being, understanding what's driving the need for an advocate program. We'll talk about our program itself, look at some testimonials and feedback from those that have been actual advocates themselves, and also those that have engaged with the solutions. Talk a bit about what we've learned from launching this type of a program, and then we'll have some time for questions. So we all understand and know that stress and burnout are significant impacts to those working in the healthcare space. And the prolonged experience of stress really leads to burnout, which is the element that we want to try and avoid by looking at these ways to build and bolster our well-being. But when burnout does happen, we see effects of that take a picture of emotional exhaustion, coming to work and feeling like you're not really yourself, or you're not capable of doing the work that you know you can do. We see reduced capacity for empathy and effectiveness, thinking that you're not cut out for this any longer, or that other people are better than you are because they can handle more than you can. And this continuous kind of washing over of this stress and burnout experience has a significant impact on the individual and on the organization. We see reduced patient satisfaction, increase in medical errors, reduced patient adherence to treatment recommendations, conflict and tension among the care team, which impacts the culture and the environment that physicians and care workers work in, increased malpractice risk, and an increased intent to actually leave healthcare. This really does set the stage for the importance of what Vital WorkLife offers in terms of well-being solutions, and how we really position advocates within an organization to talk about those solutions and encourage their colleagues to engage with them. According to projections by the Association of American Medical Colleges, we're seeing that the nation will be short more than 130,000 physicians by 2025. It's a staggering number to think about. Many factors are certainly playing a part in that, but a great deal of that has to do with stress and burnout, and with the challenges that exist within practicing medicine and functioning within the healthcare environment. Vital WorkLife really has been called upon both for our passion for physician well-being and for our understanding of well-being itself. We've really identified that there has to be something that we're able to provide to address the barriers to well-being and the access to solutions in order to help physicians to really establish a better sense of well-being, so we're not looking at this kind of shortage in just a few short years. One study done by the Physician Foundation found that 49% of physicians would not recommend medicine as a career to their children, and 48% of the physicians in that study had identified that they plan to cut back on their hours, maybe retire early, take a non-clinical job, or decrease the intensity of the practice that they have. And it's no wonder then that we're looking down the way to a physician shortage. So it's our responsibility as those in the well-being space to think about how can we support the well-being of physicians now, so we're not seeing this desire to leave because of these heavy burdens that stress and burnout can bring. So what do we do about that? How do we decrease those percentages of physicians looking to leave medicine and looking to leave their practice? Well, Vital WorkLife strives to help organizations to develop an entire culture of well-being. Starting as an EAP company, our roots in well-being and employee health matters really helped us to understand the need to develop and create a division within Vital WorkLife in 2009 for physician wellness services. And we really designed it to address what we saw as the major drivers of physician stress and burnout. We know that physicians just simply don't use traditional EAPs. They definitely could benefit from the solutions that exist, but there's elements about an EAP that don't speak to the physician need, to their ability to access the solutions. And so we knew we had to build something different. We had to establish something different that really spoke to the needs of physicians and the way that they wanted to access and engage with their solutions. So we address physician and provider burnout by providing preventative resources and helping them to build pathways to sustainable and healthy behaviors. So we do that through a robust suite of solutions that's available. And this is really how we prepare our advocates to talk about well-being with the physicians and the colleagues within their organizations. We help them to share that it's significantly more than just a burnout prevention program. There's a whole suite of solutions that are available really for every area of wellness and well-being within that physician's life. So the advocate learns about the various solutions that are available, and then they're able to help plug their colleagues into those areas that could be of assistance. So you'll see here we have legal resources, financial resources, educational and training sessions, if there's a need to develop communication skills or time management, to learn how to run a huddle or to bring folks together, plugging into those that help to really address what's causing that stress and hopefully help to not lead to burnout. We have physician peer coaching, where physicians are able to speak with a peer who has really walked in their shoes, been there, done that as a physician, and is now a certified coach, to be able to talk about practice challenges or issues within their collegial relationships or systemic challenges that they're trying to navigate, really, and get that perspective of someone that has been there in their shoes. There's a work-life concierge service, so helping with those things that we know physicians can't leave in the middle of the day to take care of, picking up dry cleaning, those kinds of things. Our advocates are listening for that as they're out in amidst their colleagues, listening to what those challenges are, and then they're able to, like I said, plug them into the resources that are going to really impact their well-being at that time. Connecting them through their mobile phone. Everyone has their phone on them all the time, and so helping them to download the mobile app so they have that quick access right in their hand. Maybe when they're walking down the hall, maybe when they're heading to their car at the end of the day, maybe when they have time between cases. They're able to do it on their time in private and in a way that really makes it personal and connected for them. Knowing that we have virtual and face-to-face counseling as well, connecting for those maybe more mental health needs, familial issues that are happening, relationship stressors that really get in the way of well-being and certainly impact all areas of anyone's life if those are challenges that they have. So this well-being advocate that we have within the organizations really connects all of these solutions together and helps to paint the picture for the physician of all the options that are available to affect their well-being. In 2017, we conducted a national survey to look at a couple of areas to see how physicians and clinicians and providers were impacted by things like culture, workflow, and the availability of the resources that they had at their fingertips or not. And then really what solutions did they want to access and what solutions really would make a difference for them in terms of their own well-being. Here's what we learned. So culture is the most important influence on a provider, physician, or clinician's well-being. This is what the physicians that took part in this survey told us. There was concern about leadership awareness, that they didn't understand really what was driving burnout, what was driving stress, what made it challenging to be a part of this environment and a part of this culture, as well as investment by leadership to provide the resources that they needed. So again, having a traditional EAP is a great foundational support for employees. Physicians aren't using those types of resources. We also learned that physicians face extensive barriers to access in really just getting connected to the resources that are even offered out there. So they don't know about them. There's not traditional channels to provide that information to physicians. Reading emails isn't something that physicians have time to just sit down and do every day. Many times other people are doing that for them, or it's backed up so much that the things that are sent are just buried and lost. And so understanding, how do we reach physicians? How do we connect with them and help them to understand what's available so that they can get the support that they need? The other element that we learned was that leadership, if they're not supportive of taking care of well-being and addressing stress and burnout, when they do provide some sort of a support or identify some sort of program, the motives behind that feel a bit suspect. And so making a more comprehensive offering, including this boots on the ground approach of having an advocate, instills that trust within an organization. We definitely saw having this advocate program as a way to strengthen culture, because the advocates are there within the organization, and they're a face of the organization, speaking about the importance of well-being. So our program started, we had our first advocate start in 2018, September of 2018, and we built the program using this evidence about stress and burnout, and how it has to, the solutions for it have to be tied to leadership and to culture, to process and to efficiencies, and understanding that there's a systemic impact when it comes to stress and burnout, and that takes time to change those systemic types of impacts, and certainly people are in it for the long haul to make sure they see those changes happen. But we also knew that we could provide support on an individual level for individual physicians, practitioners, providers, so they could start to address their own well-being and not having to wait for system-wide, culture-wide shifts and changes to happen. So the purpose of our advocate program was really to support a well-being resources engagement strategy. So our organizations that have our well-being solutions, how can we support engagement in those solutions? So we do that by positively impacting the launch effort. So being there, like I said, boots on the ground to talk about the program, and also to encourage ongoing utilization and engagement in the program. So we found that by training these internal program advocates on strengthening the culture of well-being, was that it really kind of deepened the understanding of vital work life, and it really deepened trust within the organization. The physicians, providers, they felt like this is really here to stay. This is a suite of solutions. This is something that's here in my organization that's an investment for me, and it has an impact on retention and growth of those physicians. So the other, I think, interesting part of this model is that we built it on a peer model, and there's research out there that really supports this idea of why peer support and a peer model is really important in healthcare, and especially for physicians. And like I said, the current work out there on stress and burnout really takes a fairly large systemic view, and so recognizing that, very important, the cultural piece of an organization certainly is an important focus, but we really could have an impact on those individual physicians by setting up this peer-to-peer model. So we know that recent national survey reports that medical practice is one of the loneliest professions in the United States. Yes, they're in a large hospital all day, talking to colleagues, talking to patients, interacting, but the internal loneliness that's experienced by physicians is a significant driver of stress and burnout. Again, physicians don't use those traditional vehicles for support. If an EAP exists, it isn't something that they're reaching out to that really fits in with the support that they need. The ease of talking with someone who truly understands the unique values, roles, and responsibilities of that healthcare professional is paramount. So really knowing what it's like to work a double, to have an adverse event, to deal with horizontal hostility within a healthcare environment. Having a sense of that and being able to have that coaching background to assist with some of the needs that physician might have really creates that deeper connection and that element of trust between the physician and their peer coach or their peer advocate. Benefits of that peer model really include validation, affirmation, normalizing of their experience, which is so very important, and really an understanding that that whole idea of walking in their shoes, that a counselor can be there to validate and to normalize, but really to say, I do know exactly what that means. I've been there. I've held that position. I've considered leaving medicine. I've been in that mindset. Really is a powerful experience. And engaging in that peer support kind of program doesn't carry the same type of stigma or barriers. Sharing with someone that it's okay to get help, it's okay to feel the way that you feel, that's a normal thing to go through when you have an adverse event occur. Hearing that from a peer who's been there lands differently on that physician than if it was from someone who really hadn't experienced that. So when we look at the program itself, it's important that we're engaging leaders and organizations and identifying people within their organization that fit this criteria and that maybe already are seen either as leaders or influencers or people that their colleagues listen to or maybe come to already for support, for questions, someone that really engages with their colleagues in a way that helps to really fulfill these ideal qualities of that well-being advocate. So clearly we want them to be a successful communicator because they're going to represent your organization's effort to affect the well-being within the organization. They're going to be the one talking about the program, sharing, news about potential new solutions that are coming out or ways to access or new programs that are being offered. So they have to be ready to be out there and talking about what's available. It's good if they have a kind of an initiator mindset, that they want to spearhead efforts to make sure that people know about the program. Some examples that we've had of prior advocates have created a committee of all of their advocates, or they've given all of their advocates a assignment of attending 2 department meetings this quarter. And so coming up with these ideas of how to engage and share the resources across the organization. Similarly, they have to be that motivator, talking about the importance and the effectiveness of our well-being resources, giving examples of how to use it, ways that they can use the concierge to save some time, to plan a vacation, to send flowers to someone that they've been thinking about doing and they haven't been able to. Really being out there and kind of cheerleading this idea of engaging with the resources that are available. Working with, benefits or HR departments or department chairs to be able to say, how can we promote this together? How can we all be talking about this and sharing what's available through Vital WorkLife so all of our physicians understand the depth and breadth of the resources that are available. And then we really ask our advocates to be a role model. We ask them to engage in the resources themselves, make good choices for themselves, show how to have, that good work-life balance, and talk about their own well-being experience so their colleagues can understand what it means to engage in these solutions and the impact that it really can have. We have had advocates be physicians themselves, leaders within the organization, psychiatrists, folks that, again, people go to naturally, or that are leaders naturally, or that really are welcoming and have these ideal qualities so that they're approachable and can be that good role model for their colleagues. So the responsibilities that we put on our advocates, we're asking them to assume this role for 2 years, knowing that they can extend that should that be a good fit for them. We work with the organization to help them understand that there needs to be space made for this advocate to have some time to take on these responsibilities. And all of our organizations have been very open to making sure that these advocates have time and space to talk about the solutions and to promote what's available for physician well-being. So we want them to be that inspirational voice in the organization. They want to be out there talking about the importance of well-being and how to access the resources. They have to understand the well-being resources themselves and be able to talk about how do we positively impact the culture within our organization. They have to, again, be those good role models for work-life balance and to watch for those types of challenges in their colleagues and be able to have difficult conversations, bring up the solutions that exist when they see a colleague that's struggling or hurting. We also ask that they're able to be the liaison between leadership and physicians. So to promote the well-being resources, but also to let leadership know what's working, what isn't working, what else is needed, what's the feeling, the vibe out there in terms of how the solutions are being used and being understood by the organization. And again, looking for ways to promote the program. How do we let people know about it and help them to understand that the solutions exist? So let's look at the journey of an advocate. Once an advocate is chosen and identified by an organization, how do they get ready to really be those boots on the ground and the voice of vital work life within their organization? So it's a path that they all get on. And organizations will identify their advocates, and then we as Vital Work Life will reach out to them and set them on this path to their role as the advocate. So Vital Work Life talks to our clients about what the possibility is for an advocate and what that might look like within their organization. And then the organization, with our support, chooses who those advocates could be, who they might identify within their organization. So the advocates are given a welcome letter, access to their own advocate landing page, where it has all of their resources, all of their onboarding materials, everything they need to really fulfill the role successfully. Once they're on the website and they've kind of launched into their advocate program, our advocate coach reaches out to them and starts to schedule their onboarding sessions. So our advocates have 3 onboarding sessions that they engage with telephonically or virtually to really prepare them in this role of an advocate. They have access to their webpage, they schedule their onboarding sessions, and then there's surveys that they complete throughout their onboarding to just identify what their experience was and what might be needed to give them the tools that they need to be a successful advocate. We ask that they then, are kind of released into the wild to head back into their organization and to share what they've learned about Vital Work Life. They have constant access to the website for advocates and also to the Vital Work Life resources. They're connected with our Wellbeing Advocate newsletter, and this year we're going to start doing advocate debrief meetings to bring all of our advocates together to talk about what's working, what are best practices that you have, and what are some tools that would help you to be your best advocate. Our coach then follows up with them at 3 and 6 months to gather qualitative data. How's it going? What can we do differently? And provide support, because most likely our advocates have had some challenging conversations throughout their time within their organization serving in this role. And so we want to be able to connect them back with their coach, back with their peers to talk about any challenges that they may have had. So I just want to walk you through to give you a sense of what this onboarding looks like and how we really do prepare these advocates. So in this first session that they have, it's really just an overview of the solutions that are available, helping them to understand what gets in the way of their colleagues reaching out for support. We talk about the business case for physician well-being, share with them the statistics like 50% of physicians would not recommend medicine to their children, or 48% of them are thinking of cutting back or leaving altogether. And so why is that important? And how can we affect those decisions for physicians through empowering them to take care of their own well-being? Each of our sessions has homework and optional reading provided. I'll tell you, we have 69 current advocates. As far as I know, all of them have engaged 100% within their onboarding sessions, and the vast majority of them do their homework, do the additional reading, come to their next sessions ready to talk about it with questions and scenarios and ideas around how they can apply it in their role as advocate. Session 2, I think, is the most important, I don't think it's just because of my background in mental health, but I think the idea that we really have to have this focus on our own well-being before we can be advocates for the well-being of others. And so session 2 for our advocates really focuses on where are you at within this Vital Work Life wheel of well-being? Which areas of your well-being need to be taken care of? Which elements of who you are and how you operate need some attention so that you can be your best self? We provide information on stress management and mindfulness to be able to get those advocates in a place of understanding their own well-being better, so that when they go out, they can talk both from a personal perspective of here's what I've been working through, but also understanding that that it's a journey. And so having that empathy for their peers who might be just starting on their well-being journey as well. The third session is where we kind of start to wrap up and say, here's how you have some conversations with your colleagues about how do they engage with these well-being resources, because that can be a difficult conversation to have. How do you bring up, hey, I think you're stressed, or hey, I think you could really, use counseling. We're not advocating for that kind of conversation, but what we are doing is preparing our advocates to have those difficult conversations. How do we approach someone about their well-being? How do we approach someone about experiencing or displaying signs of stress or burnout? So really giving the advocate those tools to have those conversations, but also extending a lifeline back to their advocate coach to say, if you have a difficult conversation, or if you have a colleague that you see is struggling and you want help with how to approach them, to introduce them to these resources, let us help you. Let us help coach you on how to say that and prepare you to have that challenging conversation. So when their 3 onboarding sessions are complete, the advocates then get a check-in session with their coach at 3 months and at 6 months to just see how things are going. What would you change? What's needed? What are you seeing in your organization since you've been there talking about these solutions? And we continue that conversation. I wanted you to see some of what our actual well-being advocates are saying about their experience with onboarding and being really chosen for this, this really special role within their organization. The kind of light bulb moments that our advocates are having about not only their own well-being, but also the importance of having a focus of this on in their organization. Really knowing that just talking about it, or just saying, hey, did you know we have peer coaching? Or hey, did you know we have this concierge service? Starts to pique interest from their colleagues and allows them to open the door to having a conversation about well-being. Again, most of our advocates really come to us and say, having that time to focus on myself and my own understanding of my well-being put me in a great place to be able to have those conversations with my peers. Our organizations are also giving feedback about what it's like to have these advocates within their organization, being another voice for well-being. So our organizations have identified that using those advocates to listen, while they're out there on the floor with their colleagues, listening for what's needed. So they're hearing things like, physicians thinking about being close to the end of their career, talking about maybe coaching needed for that, or other physicians talking about their last child graduating and them needing to plan a grad party. Having someone out there listening for that and hearing what's needed in terms of people's work-life balance, their own well-being, can help leadership to be more connected to the organization, the folks working in the organization. A lot of our organizations have advocates serving on well-being committees, so that dual role increases their visibility and their own awareness of what's needed, but also awareness of who they are, so their colleagues know who they can come to. Organizations have had really nice success referring providers to our peer coaching solution. And when we're looking at things particularly like core patient satisfaction ratings, having that peer coaching to talk through that and identify for that physician what's needed has been really successful. And our organizations just overall have had a real appreciation for our focus on developing these advocates, and knowing that by doing that, we want to really set up the physicians for success within those organizations. So these are some testimonials, again, that I wanted to include from those that have engaged in physician peer coaching themselves, talking about what it's been like to talk about these types of things and the impact that it's had not only to that physician, but as you'll see in the first one, to their spouse. So that physician taking some time to improve their own well-being and identify, what am I doing that's impacting my well-being right now, kind of open their eyes to see, oh, it's impacting other people's well-being in my life too. And so we like to hear about those ripple effect moments that occur when physicians engage with our solutions. The second quote here I really like too. My coach helped me to see that I was spending too much time engaging with the wrong people around things I was upset about. Really identifying what that person had power over and what they didn't, help them to let go of things and decrease the amount of stress that they were carrying with them to work and consequently back home at the end of the day. I want to share with you some of our comparison information because it was so important for us to understand what is the impact that advocates are having on physicians actually engaging with the solution and utilizing the Vital WorkLife suite of solutions that's available. So typical utilization engagement for our physician market is about 4 to 6% of the total population utilizes the physician solutions. It's very typical and something that actually, you know, if we can get within that percentage, we're happy to be reaching that percentage of the organization. What we found in our program, after 3 months for organizations who had advocates, their average engagement of their physician population was 7.9%. So we were above our typical and really getting into a space of reaching a significant portion of that organization. When we looked at similarly sized organizations that didn't have advocates, their average engagement was 2.4% over those 3 months. So a significant swing in who the advocates were able to speak to impact, and ultimately have engage and reach out to the solutions. So a couple things that we've now learned having done this and continuing to do this and make changes to the program, enhancements to the program, and also sharing what we've learned has been an important part of how we can really spread the ability to talk about well-being and encourage different ways to open up the well-being conversation. So of course, advocates themselves have reported improvements in their own well-being through going through the onboarding and talking about well-being and the solutions that are available. In order to lead this, we encourage that CMOs have a solid project manager to support them in this endeavor. So making sure that someone who's in charge of the group of advocates really is an identified person that can manage the group and manage the activities of the advocates outside of the CMO's role. Organizations really should gather their advocates in an intentional way. We have some organizations with 2 advocates, we have some organizations with 10 advocates, and so we encourage you to think about, how do I gather them together for them to draw support from one another, hold each other accountable in their role, but also to share what are they learning, what are they seeing, and how can they really kind of spread what they're doing throughout the entire organization. Having our behavioral health orientation and our 35 years of EAP history behind us has really allowed Vital WorkLife to uncover and support the development of these advocates to be able to understand well-being in a different way. We really come at it from this place of self-awareness, of resilience, and really understanding how are my choices impacting my well-being, and how can I spread that message and help others to really see that too. And I think the solutions that we offer and the support that advocates have and give within their organizations helps to really deliver that well-being message from Vital WorkLife. We also know and have seen that this advocate role can lead to internal organizational discovery. So again, having those boots on the ground, those advocates out there in amongst their peers, can lead to seeing things like gaps in those well-being programs. What else is needed? What are we missing? What can help build trust between leadership and the workforce? Where do we need to communicate about well-being more? Where are we doing well? How can we celebrate the well-being work that we're doing within our organization? And those advocates become that liaison between the physicians, the leadership, and really by being there, impact the entire culture of the organization. I'd love to take any questions or comments that you have about the advocate program that we've started and are working on here at Vital WorkLife.